"Doctor, I have been diagnosed with chronic kidney failure and I am going to start dialysis. They have placed a catheter here for me to undergo dialysis. And now the doctor is telling me that I am supposed to do something called an arteriovenous fistula, or a device to use for dialysis. What is this device, and is there any risk involved? Why can't I continue using this catheter for dialysis?" Let's simply understand that when we first start kidney dialysis, we either place a temporary catheter or a permanent catheter. The purpose of this catheter is to perform the dialysis process. So why shouldn't we continue using the catheter and instead create an arteriovenous fistula? First, we need to understand what an arteriovenous fistula is. An arteriovenous fistula is simply connecting an artery to a vein so that we can draw a large amount of blood. The machine can then filter it. So why not just use something like a butterfly needle or cannula and start dialysis from there? That's simply because we draw a very large amount of blood from the vein quickly. If we draw this large amount of blood from a small vein where we place the cannula or the device used for intravenous solutions, it will collapse and close. So what is this procedure about? We connect the artery to the vein. Why do we do that? Because the blood pressure in the artery is high. This makes the vein enlarge, allowing us to draw the blood we need, just like when someone lifts weights. When a person starts lifting weights targeting the muscle grows. That's exactly what happens. We connect the artery to the vein in a very simple procedure. This procedure is done under the supervision of a doctor, doesn't require general anesthesia or anything, and takes about half an hour to 45 minutes. After connecting the artery to the vein, we wait about 1.5 to 2 months for the vein to mature before we can start using it for dialysis. So what are the advantages of the procedure? The first thing is that we avoid any source of infection. The dialysis catheter we use, whether permanent or temporary, is very prone to infection. And if an infection occurs, God forbid, it can lead to major problems for the patient. The second thing is that the efficiency of dialysis is greater with the arterial connection. As we agreed, this procedure takes about 1.5 to 2 months to start working. So, are there cases that require us to perform another procedure? Yes, there are cases when your vein is small. Sometimes we perform a procedure called superficialization, where we bring the vein to the surface so we can attach the graft. There is something called an artificial arterial connection. This is when it becomes difficult to connect the natural artery and vein together. We install an intermediate tube made of specific materials that serves as a substitute for this connection, and we also use it for the dialysis process. However, the time it takes for us to start using it is shorter. We need this for some patients who have difficulty in having a natural connection installed. What precautions should a dialysis patient take care of after the procedure? The first thing is that his blood pressure does not drop. Always remember that your blood pressure does not drop, because if the blood pressure drops during the dialysis process or at home, it could halt the procedure. The second thing is personal hygiene. Before you undergo the dialysis procedure, we start by washing our hands with water and soap and drying them well. After that, the nursing staff will connect the line for you. It is very important that after this procedure, we should not measure blood pressure or take any samples from the arm, because that can disrupt the process. So the important question is, why shouldn't I leave the temporary or permanent catheter instead of having the procedure? As we mentioned, this is because the catheter reaches the heart, and any inflammation resulting from sweat, water, or anything else coming into contact with it can lead to a serious and significant infection, at which point we would have to resort to antibiotics to treat the problem. I assure you, if you start hemodialysis, have the procedure done as soon as possible, because it takes about 1.5 to 2 months. It provides good efficiency in dialysis. It keeps you away from any sources of infection, and at the same time is easy for the patient, both in terms of installation and closure. Take care of your health. Your health matters to us. And don't forget, we made this video for you today with the best of intentions. I also hope that you did something good today, and always make it a habit to like, share, and benefit others. I'll see you tomorrow to check on you and make sure everything is okay.